Medication therapy management. In this slides, we will be talking about what is medication therapy management, known as MTM, and also known as the brown bag special. So, what is medication therapy management services? This is a medical care provided by pharmacists who aim to optimize drug therapy and improve therapeutic outcomes for their patients. MTMs cover a broad range of professional activities, including but not limited to performing a patient's assessment and or comprehension of medication review. We also formulate a medication treatment plan. We monitor the efficiency and safety of the medication therapy and enhances the medication adherence through patient empowerment and education. We also document these by communicating with the patients. MTM services, we have to communicate our service to the practitioners or the prescribers to maintain a comprehensive patient care. So basically, it's overall wellness and disease prevention and how to integral a part of the patient's role and the pharmacist's role and the technician's role, which often includes gathering information from the patient to complete a medication and disease history, which provides counseling documents for the pharmacist. There are 5 components of medication therapy management. The first one is medication therapy review. This is a systematic process of collecting patient specific information, accessing medication therapy to identify medication related problems, developing a prioritized list of medication related problems, and creating a plan to solve them. As a pharmacy technician, you would probably be the one that be gathering the medication off of the patient profile. A personal medication record is when a person gathers all of their meds that they are currently taking and bring them to the pharmacy review. This is called the brown bag special. When you hear the brown bag special, this is what they're talking about. A lot of our older patients keep all their medication in one little sack or one little bag. It doesn't necessarily have to be a brown bag, but they keep them all in one section and they bring all that to the pharmacy for review. Then you have the medication related action plan. This is when the pharmacist sits down and talks to the patient about what they're taking and why they're taking it. Sometimes our patient have old medication that they've had for a long time and they keep all that medication when they shouldn't be taking it. And this is when the pharmacist, after you've gathered all the information and they bring it, the pharmacist sits down with the patient and decides, oh, well, you're taking this one. You don't need to be taking that one. Okay. Intervention or referral. This is when the pharmacist sets up an appointment to go over all the medications with the patient and make suggestions to the physician about the medication. This includes OTC medications. Sometimes patients have cough medicines that they shouldn't be taking or pain meds that they got from their neighbor down the street, stuff like that that we can help them, stop having medication problems. Then you have documentation and review. This is when you actually speak to the physician's office and recommend changes and alerting the patient of those changes. And most of the time, this is done by the pharmacist. Most of the time, the patient's money and health problems like trips to the ER and more meds can be prevented by doing medication therapy management. There are 3 of the 5 following conditions that people qualify for medication therapy management program. Chronic heart failure and rheumatoid arthritis, diabetes, dyslipidemia, which is abnormal cholesterol, and asthma. They're taking more than one of these medications. to treat these different diseases that they have. They're taking 8 or more chronic maintenance medicines and they're on Medicare Part D. They are likely to incur an annual Part D medication cost of $4,255 for 2020. And in 2021, are likely to incur an annual Part D medication cost of $4,376. This type of medication therapy management is done by the pharmacist, mostly in a community pharmacy, like a retail pharmacy, and it helps them save money, the government money and the patient money. And it also keeps them in compliance with their medication. Why is medication therapy management important? It helps contribute to medication error prevention and enables patients to actively self manage their therapy plan while simultaneously giving them the opportunity to be more knowledgeable about their health and medication use. Medication therapy management is a service provided by pharmacists to eligible patients who participate in a Medicare drug plan, namely Part D. The generic population, which includes among the aforementioned eligible patients, is prone to taking numerous medication, and they tend to have multiple disease states, which lead to plethora of medication-related problems. With this medication therapy management, we can prevent some of these problems. You have where they go to the doctor and they take a medication for blood pressure, and maybe that blood pressure wasn't working. So the doctor give them another blood pressure medication. Sometimes the same medication of the same strength. And for some reason, our geriatric patients sometimes do not like to throw away the medication or like to say, well, I can take 2 of these instead of taking 1 and still use my medication. And they think it's saving them money when actually it's causing them to be confused because sometimes they forget that the doctor has changed me to another medication and they take both of them. So that will cause them to have a drug to drug interaction or will cause them to have lower blood pressure than they should have. And then this would increase going to the emergency room or having other medicated problems because they're taking too much medication. So it is important for us as pharmacists and pharmacy technicians to identify when our patients are calling in their medication, if they're taking the one that they shouldn't be taking or not be taking. And this is when we have to call the calls to ask them to come in for an MTM process. In the previous slide, we kind of hit on the goal of MTM, but in this slide, we'll be more excessive in it. So, one of the goals is to optimize the therapy outcome of individual patients as well as detect or prevent costly medication related adverse reactions. That's what I was talking about in the previous slide. Them taking too much medications for a specific illness. Through a comprehension review of all the medications, including their potential side effects, financial barriers, and how well a specific medication is working, pharmacists can help the patients come up with an action plan to ensure that they are getting the most out of their prescriptions. So the pharmacist sits down with them, as we talked about it before, and go over like if they're spending too much money on a specific medication, is this medication helping them? It also helps the pharmacists often collaborate with their patients' healthcare providers to optimize medication use for improvement health outcomes. So after the pharmacist has sat down with the patient and realized what the patient is taking, sometimes the doctors don't know what all their patients is taking, especially if they're going to different doctors. Some patients have a doctor for this and a doctor for that, and they have different medications that have adverse reactions against each other, like aspirin and warfarin. If one doctor has put a patient on warfarin and another one has put a patient on aspirin, and neither one of those doctors know that the patient is taking both those medications, it could be an adverse reaction on that patient. And during MTM, this is where the pharmacist finds out and let the doctors know, and then we can make sure the patient is being properly treated for her condition. So, how can pharmacy technicians participate in MTM? Pharmacy technicians can play a key role in helping pharmacists achieve a successful MTM program. Technicians can provide support or management roles in MTM functions, such as the following: you have medical and pharmacy record gathering, organization, and assessment. This is when the technician actually goes in and look at the patient's record and see what they're taking. We organize everything that needs to be organized, and then we would apply the assessment in the computer after the pharmacist has finished the meeting with the patient. Then you have medication reconciliation, developing a personal list for the pharmacist, correspondence with the patients, physician, and other healthcare providers, follow up to enhance patient adherence. Pharmacy technicians are broadening their training and receiving more responsibility in many healthcare settings. There is a growing need for pharmacy technician education and medication therapy management. As more pharmacy practices adopt these services, training in MTM can help pharmacy technicians adapt to the changing in the pharmacy environment and create opportunities for expanding their profession and responsibilities. The pharmacy technician can play a key role in helping the pharmacist successful in the MTM program. Technicians can provide support or management roles in the MTM functions. And this is what we do. We, like I said before, we collect the information. We recognize the problem in the patient first, because when the patient calls in the prescription, most of the time they're calling it in to a pharmacy technician. We realize that the person is taking two blood pressure pills or two different kinds of pills of a different medication, and we alert the pharmacist. Then we gather all the information, set up the time for the patient to come in, and then after the pharmacist has done his thing with the patient, going through all of their medications, we actually go in and clean up their personal file and what needs to be there and what doesn't need to be there. And sometimes we are the people that collaborate with the physicians and other healthcare providers to let them know, hey, Miss Sally is no longer taking this furosemide 40 per doctor head because he realized she's taking too much of it. And then we have to follow up with the patient to making sure that they're still taking the medication. Sometimes the patient will call in another prescription the next month because of furosemide 40 and the doctor is taking her off of it, and we have to make sure that the patient is staying in compliance by checking their medications when they call them in. So why do technicians need to education about MTMs? The healthcare environment has rapidly evolved since the introduction of MTM services approximately 12 years ago. The state and local laws have changed and continue to address new issues affecting MTM services. Procedures for planning and delivering MTM are regularly fine-tuned and updated in many workplace settings. And the opportunities for reimbursements for MTM services are being revised on a statewide and federal level. Pharmacy technicians who are unfamiliar with MTM needs a solid basis of understanding about this goal and procedures. Technicians who already have some education in MTM can benefit from updated, expanded information. As the pharmacy profession embraces extensive patient counseling in the form of MTM, many aspects of the pharmacy must evolve to ensure success of the medication therapy program. You have time constraints and limited of ability pharmacists to handle administrative tasks. So this is why it comes down to the pharmacy technician. We can do more work to reduce this barrier. With proper training, technicians can assist the pharmacist in the tasks that do not require professional judgment on the pharmacist, freeing the pharmacist to focus on clinical activities and making MTM program more sustainable. For example, a technician can help in areas such as scheduling the patients and reminding through phone calls. Medication history and health history can also be documented by the technician as a chart construction, filing, and documentation of release forms and health history. And additional steps can be taken to further increase efficiency of MTM process, including the creation of a flow map and cross training to all pharmacy staff. So this is fairly new. About 12 years ago was when it started, but the pharmacy technician has to be familiar with it because we can help the pharmacist free him up from doing the tedious tasks that we can do. Okay, I've mentioned this before, the brown bag special. The brown bag medication reviews carried out by community pharmacists is collaborating with general practitioners have come established in the US and elsewhere as an effective means of helping primary care patients to derive maximum benefits for their medications, of identifying medication problems and reducing wastage of medication. The objective was to aim where the brown bag medication review could be used successfully. The brown bag medication review were carried out with over 205 volunteers in 23 pharmacies when before we all started this. Pharmacist intervention improved patients' knowledge using the medicines were analyzed. Potential clinical problems identified by the pharmacist were analyzed in order to identify the drug group and most likely cause problems. This evolved into the MTM management, MTM services, which is medication therapy management. So you may see on your PTCB or any other test, what is the brown bag method? The answer to that question is simply medication therapy management. The pharmacist counseling the patient on the medications that they take on a daily basis and making decisions after they have spoken with the physician. They're helping the physician to maintain the patient is compliant with their medication and cutting down on emergency visits and on insurance costs. We just talked about this earlier is what is the benefit from MTM services? Patients and healthcare systems are greatly benefited from MTM services due to the overall reduction in healthcare costs. This helps the insurance and the patient um, decrease their payments of what they're paying for drugs. The risk of the patient misusing or abusing their medication is greatly reduced as a result of pharmacists being able to catch discrepancies via the five core elements provided through MTM. The pharmacist is able to catch a patient um, and they probably not even knowing that they're misusing or abusing their medication. They just simply feel like they're taking the medication that the doctor prescribed for them. But because they haven't fully understood that they shouldn't take Norvasc 5 and Norvasc 10 together, they don't realize that this is hurting them instead of helping them. So going through the MTM process with your elderly patients or any other patient that's eligible through the Medicare D program will help them understand this. The pharmacist and the pharmacy technicians play a significant role in making sure effective therapy is delivered to the patient so they can progress towards successful being able to manage their disease states. You have all kinds of disease states, diabetes, cholesterol problems, high blood pressure problems, asthma medications, and you'll be surprised at how many people use their rescue inhaler as far as asthma for one um, example. Asthma medications. They have a rescue inhaler and they have long term inhalers. And sometimes they use them too much and sometimes they use them not enough because they just completely just don't understand that this one this and this one that. So it helps them and it helps the pharmacy. It cuts down on pharmacy problems or medication problems with the patient. And it also um, forms a relationship with the pharmacist and the patient. Pharmacy is the most trusted profession in the world. So they trust us mostly more than they do their doctors. So us taking the time to analyze their medication and make sure that they understand their medication, they will greatly appreciate it. So that's the benefit. Everybody benefits. The pharmacy benefits, the patient benefits, and also the hospital benefits. In the next couple of slides, we'll be seeing the MTM in practice, where it's like scenarios that you can see how MTM helped certain customers. So, first we have Clara. She has uncontrolled asthma. The MTM savings potential is $21,419. So, Clara is a 37-year-old woman who suffers from uncontrolled asthma, unresponsive depression, pain, and nausea. She sees multiple specialists. She takes many medications, 19 to be exact, and is an expensive patient in her demographic group. So before MTM, Clara spent about $2,900 a year on her 19 medications due to her asthma. She is the type of patient who frequently landed in the hospital. So during the MTM review, Clara's pharmacists and technicians identified 5 clear problems. Clara overused her short acting inhaler and lacked a prescription for a long term controlled inhaler, meaning she didn't have one. In addition, one of her 19 medications was a duplicate therapy. In addition to that, Clara was taking any medication for depression. So she was diagnosed for depression, but she wasn't taking anything for her depression. So after medication therapy management, Claire dropped the duplicate therapy and was referred, to the physician to restart depression treatment. She stopped using the rescue inhaler as a maintenance medicine and got a long-term controller. The savings after the MTM, it repositioned Claire to avoid emergency rooms and hospital admissions, events that would have cost an estimate $24,000. Clara's 2 new medications for depression and long-term asthma control added just $188 a year to her total medication bill. Network savings was $21,419. The MTM Economics 101. Asthma patients who use MTMs are 6 times less likely to have ER or hospital events, according to Asheville's project research. So we can see in this scenario how medication therapy management actually helped Clara and caused her less time dealing with asthma, going to the hospital, and also causing the insurance companies more money. After the MTM, by helping Harold use medications correctly, medication therapy management put the middle aged patient on a trajectory to avoid hospitalization for his congestive heart failure, avoiding a $10,900 hospital bill. Medication adjustments added $261 to his annual pharmacy bill, bringing that total cost to $1,333. A total net savings for Harold for the year is $9,567. So, medication therapy economics 101. Congestion heart failure patients who receive MTM services are 50% less likely to be hospitalized, according to the study done for the Centers of Medicare and Medicaid Services. So, Harold is going to benefit by saving $9,567. And not only did he do that, he saved $10,900 with that hospital bill because of his congestive heart failure and his smoking. Now, the follow up with him would be making sure he's staying on that smoking cessation program that's going to stop him from smoking. Um, when they get to be in Harold's age, sometimes it's hard for them to quit. So we have to stay on him as far as, or like a reminder, not stay on him, but remind him about his smoking and encourage him. As a pharmacy technician, you can always encourage your patients. Oh, Mr. Harold, I see you're still taking your prescriptions, doing very well. They would like that. Okay, our last one in medication therapy in practice. We have Kimberly. She has ulcers and diabetes. The MTM savings potential for Kimberly is a whopping $34,728. Kimberly is 47 and has a life deeply entwined with the healthcare system. She struggles with more than a dozen chronic conditions that frequently lead to hospitalization. She has asthma, diabetics, high blood pressure, overactive bladder, COPD, dyslipidemia, hypothyroidism, anxiety, bipolar disorder, chronic pain, depression, osteoporosis, and ulcers. So Kimberly is taking a lot. So before MTM, Kimberly took 25 drugs that did not fully understand the complexity and interactions for many conditions and medication. So during the review, the pharmacist looked at all 25 of her medications. Kimberly's pharmacy zeroed in on four problems. Many of Kimberly drug interacted in problematic ways. Two medications duplicated each other. Kimberly wasn't prescribed a needed antiplatelet, and she had not received two vaccines crucial for people in fragile health. So after the MTM, Kimberly was vaccinated immediately for the flu and the pneumonia. Her physician added an antiplatelet medication to her regimen and discontinued another drug. Kimberly was educated about not taking duplicate NSAIDs. The pharmacy developed a review with her and an action plan to help manage her asthma. So in all of his 25 of those medications, some of them wasn't taken away because she really needed them, but some of them interacted with each other. So she had to, make sure he had to talk to the doctor and let him know what she was taking. So, in savings after the MTM, Kimberly's medications change improved her health by having little effect on annual prescription costs of $4,100. The MTM consultation made it possible for the chronically ill and costly patient to avoid an estimated $38,860 in hospital costs for visits related to pneumonia and gastrointestinal bleeding. So, MTM Economics 101. In October 2015, Medicare, with reduced reimbursements for hospitals whose COPD patients, such as Kimberly, were readmitted at higher than desired rates. Vaccines has been shown to be effective in helping prevent readmission. The study of Medicare previously referenced found that MTM saved an average of $1,034 in hospital costs for those who recently been admitted to COPD or CHF. So this helped Kimberly, and it also helped the government save money. So in conclusion, why wouldn't we invest in a service that costs a fraction of savings that it provides? Especially when MTM consultation can produce average savings of more than $1,000 and oftentimes 30 to 40 times that per patient. That's the type of return that MTM produces when applied to skillfully and clearly defined cohorts and when results are measured comprehensively. Carol, Harold, and Kimberly and other chronically ill patients are high risk, high cost patients that challenge our industry ability to control costs. At the snap of a finger, they can become a preventable $10,000 hospital stay. Right now, only 1% of eligible patients are getting MTM services. When these very services can be help avoid preventable hospital stays. This treatment gap is one of the healthcare's great financial and clinical opportunities. Interventions are made 87% of reviews. Interventions to improve patients' knowledge of the purpose and correct uses of their drugs were made in 65% of reviews. In 12% of reviews, problems were identified that could potentially result in hospital admission, and the potential for improved outcome for the patient drug therapy was identified, and further 30% of cases. Beta blockers, NSAIDs, are identified as being associated with potential problems of the highest clinical significance. Patients taking psychoactive medications are greater risk of medication related problems from any cause. So, pharmacists and pharmacy technicians can contribute to patients' welfare and reduce health costs by carrying out the brown bag medication review, known as medication therapy management. This can be used when you're using the patient, when you're taking medications for the patient. This one over here is the review for the pharmacist. He would actually put down, this is what I need to do, and this is what I did when I did it. So we need to talk to the patient, and they fill all this out, and they use these to talk to the physicians. They may even fax this over to the physician so the physician can have a look at it. And then these forms are scanned into the computer so that you can prove that you actually did a medication therapy management on this patient. You will learn how to do these with made up patients. This is when we would have any questions for the medication therapy management. It is very important that we perform medication therapy management on as many customers as we can. Remember, the goal in our profession is to make sure that our patients stay safe, to make sure that they are compliant with their medication. And this is one way that we can do it, is helping the pharmacist with medication therapy management. I would like to inform you that no, you are not allowed to do medication therapy management on a patient without a pharmacist present. The only thing that you can do as a pharmacy technician is recognize that it should be done and gather the information, make appointments, and if the pharmacist feel that you can do it, they could have you talk to the doctor or the nurse. But most of the time, they do this. So if we have any questions, this is when we will talk about it. And you're going to have a small assessment after this PowerPoint.